Hello, my name is Dr. Dewan S. Raja. Today I will discuss about the pharmacology of macrolides. Macrolides are the erythromycin, azithromycin, clarithromycin, telithromycin, fidaxomycin. This is the newest member. This is the oldest member of macrolides. Erythromycin is the first drug among them. Among these all, clinically used as an alternative drug to penicillin allergic patients. Mechanism of action of the macrolides. The macrolides bind irreversibly to the 50S subunit of the bacterial ribosome, and that's why they are protein synthesis inhibitor. They inhibit translocation steps of protein synthesis, interferes with transpeptidation. They are bacteriostatic but may be bactericidal in higher doses. The therapeutic uses vary from macrolides. So erythromycin has the spectrum less than that of the azithromycin. Fidaxomicin, even its spectrum is less and it is specific. Okay, so it depends on type of the macrolides. In general, they are used as an antibiotic for chlamydial infection, specifically the azithromycin. This is the STD. It causes UTI. It is also useful in the management of pregnant women with chlamydial infection. Mycoplasma pneumonia. This is an atypical pneumonia. The organism, the bacteria is difficult to identify. Corynebacterium diphtheria, cause of diphtheria, Legionnaire's disease. Usually people who are exposed to air-conditioned devices. Syphilis is a STD caused by Treponema pallidum. AIDS caused by HIV infection, and in AIDS it is useful macrolide to the management of intracellular avian type of Mycobacterium infection. Bordetella pertussis causes whooping cough, Campylobacter jejuni that may lead to food poisoning. Haemophilus influenza, Moraxella catarrhalis, again Neisseria gonorrhea that cause gonorrhea, another STD. Staphylococcus aureus, Streptococcus pyogenes, okay, and Streptococcus pneumonia. And this is the Clostridium difficile, okay, that is managed by fidaxomicin, and Clostridium difficile may lead to pseudomembranous colitis. Usually, this is an antibiotic. It works like that of the vancomycin. Pharmacokinetics, all the macrolides are absorbed adequately by oral administration. No CSF entry, so they cannot enter the cerebrospinal fluid because they cannot cross the blood-brain barrier. The erythromycin are enteric-coated. Okay, they are enteric-coated because they are vulnerable to gastric acid, that is the hydrochloric acid, because of they contain acetylate salts. Other macrolides are not destroyed by the gastric acid, that is the hydrochloric acid, only the erythromycin. So it should be given as enteric-coated tablet. Azithromycin has the highest half-life, 40 hours, and has intravenous preparation. The erythromycin should not be given intravenously because of chance of thromboembolism is too much with erythromycin intravenous. So azithromycin is the drug that may be also used intravenously. Except for erythromycin, all are converted into an active metabolite, metabolized in the liver, excreted through the bile and urine. And the clarithromycin, it is excreted around 50% through the urine. Adverse effects. epigastric distress, pain in the abdomen, cholestatic jaundice, specifically due to erythromycin, there is a possibility, then allergic reaction, autoimmune mechanism, or allergic reaction to erythromycin because of its presence of acetylate salt. So cholestatic jaundice is especially associated with erythromycin because it contains a salt called acetylate salt. Ototoxicity, there may be hearing loss that may be transient or temporary. Tinnitus, that is a ringing sound or buzzing sound in the ear. Telithromycin, this is the drug here, may worsen myasthenia gravis, one of the neuromuscular disease. And macrolide can prolong QT interval, and in animal study they may lead to torsus. The point is cardiac manifestation. Contraindication in patients with hepatic failure and renal failure. Drug interaction, the macrolide inhibits the hepatic P450 system, and so that metabolism will not occur or maybe inhibited. There will be increase in the serum concentration of ST-mesone, one of the antihistamine withdrawn from the market because it may cause cardiotoxicity. Theophylline is a medication used in case of bronchial asthma, valproate. It is an anti-epileptic drug, warfarin, anticoagulant, cyclosporin, anti-allergic, and also an anti-cancer drug, cyclosporin. Carbamazepine, that is also an anti-epileptic drug, also in management of pain. Degox, these all are affected due to inhibition of the hepatic P450 system. Okay, we have that problem. And in case of digoxin, we have different type of problem. Digoxin should be degraded in the intestine by some type of bacteria. The macrolide actually kill those bacteria, so the digoxin level is increased in the body. It is more absorbed in certain situation. So there may be toxicity due to digoxin. Okay, we got that. And that's all about the pharmacology of the macrolides. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.